Well, guys, my fellowship is coming to an end with Atlantis, at least for this term. On day 4, I was in gastrointestinal, and we done endoscopy procedures, either gastroscopy or colonoscopy. We had one patient that had anemia, and we had to go in. We found out that she had polyps, so it was removed through the endoscopic equipment, which includes 2 lights, an air hose, and a camera. Um, it was removed with a snare and current, which was pretty much cut and burn the polyp to eliminate or minimize bleeding. There was a polyp biopsy done. There are 2 types of polyps. There's cystal and poietal, which is like a stalk like a tree. The patient was given propofol via IV, so she pretty much had a polypectomy. We also found out she had internal hemorrhoids. She spends 1 hour in the recovery room, and then if bleeding occurs within 2 days to 2 weeks, she needs to immediately go to the ER. One of the gastroscopies we done was due to chronic inflammation of the mucosa in the throat. The patient had daily emesis or vomiting. We also found a hiatal hernia. Her risk of cancer was higher. The biopsy needed to be repeated yearly to every 5 years, depending on the severity, and hers needed to be repeated 6 months after the procedure. The patient also had dysplasia and the skin pathy of scleroderma, which had limited movement, lack of blood flow, retracted muscle, and it was difficult to reach vein. This is an autoimmune disease. She was given a topical anesthetic, lidocaine, and the biopsy was taken with forceps. Her diagnosis was officially hiatal hernia and gastritis. The next one was another colonoscopy due to rectorrhea, which is bleeding through the rectum. We found out she had internal hemorrhoids, and the procedure was hard due to low body mass. The next patient was tested due to suspicion of colon cancer. So they do a blood test and a fecal matter test, and the patient's results were 155. The normal range for fecal matter test is 0 to 100. If the results are between 70 and 95, the test needs to be repeated in 2 years. We had an exploratory gastroscopy, only given topical lidocaine, no sedation for that patient. The next one was a gastroscopy due to abdominal pain and acute anemia. Patient was on anticoagulants. Patient has atrial fibrillation and a hip replacement, as well as dementia. She was given the topical anesthetic, no sedation, diagnosed with esophagitis, inflammation of the esophagus. There are 3 stages of that. She had stage D. Stages C or D do need a second look, so she will have to be in. I also asked the doctor about nurses, where I'd informed you about how to become a doctor in Spain. I hadn't informed you about nurses. It takes 3 to 5 years to get through nursing school, so pretty much the same as in the U.S. My last day, which was Friday, day 5, I was in gynecology and obstetrics. Pregnancy obviously has 3 trimesters. Patient 1 was in the 3rd trimester with her 2nd child. In the ultrasound, you look for the diameter of the head and belly and length of the femur. Patient number 2 was in her 3rd trimester with major fetal movement. The vitamins she was on were euphoric acid, iron, and iodine. I also found out that PCOS is very, very frequent in Spain, which is polycystic ovarian syndrome. Patient number 3 was in her first trimester with her second pregnancy. Um, she was 12 weeks and 5 days, so the screening for chromosomes 13, 21, and 18 are there. Spinal bifida is tested in the second trimester along with other malformations. Between 12 and 13 weeks, they are tested for the bad chromosomes. In these ultrasounds, you must see the brain, which looks like butterfly wings, bones of the head, legs, arms, and the eyes. Patient 4 was actually a delivery. The midwife was this deliverer on that as the doctor stood back. This is her second pregnancy. Her first one vaginally. Her first pregnancy was a C-section. This was a low-risk pregnancy. The umbilical cord was around the neck, but they did get that figured out. So they take a sample of blood from the umbilical cord for tests to test pH, blood type, and Rh positive or negative. They do immediate skin-to-skin contact. The placenta must exit. If it does not, it must be done manually. They search for lesions or harm to the birth canal. There was a small suture needed. Bupivacaine was the local anesthetic used there. You called pediatrics and give them the weight, height, and head diameter, how much they move, skin, and their breathing. The uterus should feel like a hard bowl and it needs to be massaged back in place. They stay for 2 hours after delivery, and then they go home without any other complications. Pediatric does not come into the delivery room. They are waited till they are moved to another one. The epidural was in an IV line that was a PICC line anesthetic. I need to do more research into that. Patient number 5 of the day was in her third trimester with her first pregnancy. The baby is currently breached. A C-section was mentioned, also the turning of the baby. Patient number 6 was in her third trimester with type 2 diabetes. She was a smoker and took insulin daily. She previously had a C-section. The baby's was about 4 kilos, and that was a big baby due to diabetes. She has a negative Rh, so she's given gamma and hemoglobin injections. The patient also visits the endocrinologist since the risk of the baby being large. Patient number 7 was at the end of the first trimester. She was rechecked for fetal bladder and stomach size. There was an uncommon ultrasound and an unknown spot, so the doctor called Madrid, and we did not get any word from that before leaving. Patient number 8 was 36 weeks. She was in her third trimester with her first pregnancy. She was measuring 10 days behind, possibly because the pregnancy was dated wrong during the first ultrasound in the first trimester. He's measuring about 2 to 3 weeks smaller, but if they're thinking it's 10 days, then that's okay. She needs to visit every 2 weeks to monitor until in labor. Patient number 9 is in her first trimester. They done the test for chromosomes. You measure head to tail measurements for that. Butterfly wings were present. Low risk of chromosome mutation and a low risk pregnancy overall. Patient number 10 was 35 weeks and 4 days in her third trimester. She has pulmonary thrombosis and lupus. This is her first pregnancy and high risk due to disease. Ultrasound did show that the baby was very healthy, and it has been a healthy pregnancy so far. Other than that, I'm pretty much waiting on at the airport to catch my flight to Amsterdam next, which is not an Atlantis thing, so I will probably put a video up for that, but there's no need to continue following if you're following for Atlantis. I actually have the opportunity to return this summer and along with winter breaks as a junior site coordinator. The only obligation I have is to be able to speak Spanish fluently. I would be here for 5 months during the summer. I would still be able to shadow. I would take all the students around, and I would go back to Almanza, which I loved. Small community, reminded me of home. I was the only person from a small town. Everybody else was from big cities, New York, San Antonio, Boston, Washington, Baltimore, Charlotte. So coming from little old Bluefield, it was very different. I rather enjoyed it. The others said they were bored, but I love the culture. I love I love being in the hospital. There was a lot of respect for all healthcare workers. The nurses and the doctors are actually on the same level. They're treated the same. They both know they need each other. So it's great. Like, even the head of surgery will jump in and do a nurse's work because he's not above that like in the U.S. If you're not a doctor in the U.S., you're nothing. You don't get any kind of respect. But here, all healthcare professionals are respected. It's different, especially coming from my experience working in healthcare in the U.S. already. I do look forward to coming back, and I am kind of ready to go home, but I'm going to miss Almanza. I'm going to miss Spain in general. So I board in about an hour, and we'll be back in the U.S. I will land in Atlanta at just after 8 p.m. tonight. So